Welcome to our channel. Today, we are going to discuss a topic that affects many women and their families. Miscarriage at 19 weeks. It's a sensitive subject, but one that deserves attention and understanding. Have you ever wondered what causes a miscarriage at this stage? Or perhaps you are looking for tips on how to cope with the emotional impact? Stick around because we have all the information you need in this video. Understanding miscarriage at 19 weeks. Miscarriage is the loss of a pregnancy before the 20th week, and a miscarriage at 19 weeks can be particularly challenging. At this stage, the expecting parents may have already bonded with their baby and started making plans for the future. Let's take a closer look at the causes, symptoms, and emotional aspect of miscarriage at 19 weeks. Causes of miscarriage at 19 weeks. Several factors can contribute to a miscarriage at 19 weeks. It's important to remember that it's rarely fault of the parents. Some possible causes include chromosomal abnormalities. The most common causes of miscarriage where the baby's genetic material isn't developing as it should. Maternal health issues. Conditions such as uncontrolled diabetes, hormonal imbalances, or infections can increase the risk of miscarriage. Uterine abnormalities. Certain structural abnormalities of the uterus, such as septum, a wall-like structure dividing the uterus, fibroid non-cancerous growth, or cervical insufficiency, that's weakening of the cervix, can increase the risk of miscarriage. Infection. Infection in the uterus or reproductive organ, such as bacterial vaginosis, pelvic inflammatory disease, PID, or sexually transmitted infection, that's STIs, can contribute to a higher likelihood of miscarriage. Lifestyle factors. Certain lifestyle choices such as smoking, excessive alcohol consumption, illicit drug use, or exposure to environmental toxin can increase the risk of miscarriage. Symptoms of miscarriage at 19 weeks. Recognize the symptom of miscarriage is crucial for seeking medical help promptly. Symptoms may include vaginal bleeding. Heavy or persistent bleeding that goes beyond light spotting should be a cause for concern. Cramping and abdominal pain. Intense cramps or abdominal pain, which may feel similar to labor contraction, could indicate a miscarriage. Back pain. Persistent or severe back pain, especially in the lower back, can be a symptom of miscarriage at 19 weeks. It may accompany other signs such as bleeding or cramping. Decreased fetal movement. If you notice a significant decrease in your baby's movement, or if the baby has completely stopped moving, it could indicate a potential problem and should be evaluated by a healthcare professional. Passing tissues or clots. During a miscarriage, you may pass tissue or blood clot from the vagina. This can be accompanied by heavy bleeding and severe cramping. It's important to seek medical attention if you experience this symptom. Coping with miscarriage at 19 weeks. Experiencing a miscarriage at 19 weeks can be emotionally devastating. It's important to acknowledge and process this emotion to begin the healing process. Here are some tips to cope. Seek support from loved one. Reach out to your partner, family, or friends who can provide a supportive and understanding environment. Join a support group. Connecting with others who have experienced a similar loss can be tremendously helpful in finding solace and shared experience. Take time to grieve. Everyone grieves differently, so allow yourself to feel the emotion and take the time to need to heal. Seeking medical attention and future pregnancy. After a miscarriage at 19 weeks, it's essential to seek medical attention for a thorough evaluation. Your healthcare provider can offer guidance and support. Additionally, if you plan to conceive again in the future, consider this aspect. Waiting period. Your healthcare provider will advise you on the appropriate time to wait before trying to conceive again. This allows your body to heal physically and emotionally. Preconception care. Ensure you are in good health before attempting to conceive again. Address any underlying condition and maintain a healthy lifestyle. While miscarriage at 19 weeks can be a heartbreaking experience, it's important to remember that you are not alone. Reach out for the support, take the time to heal, and don't hesitate to consult with your healthcare provider. If you found this video helpful, please consider subscribing to our channel and sharing it with others who may benefit from this information. Remember, together we can build a supportive community and provide comfort during difficult times. Thank you for watching.